I think we're going to be connecting now with Dr. Jason and Dr. Sophia.
Can you see us?
Hi, yes, we
Hey,
do.
Amanda. How are you?
Good, how are you guys doing?
We're doing great.
Can you hear us okay?
Thank you so much for coming on board today. The viewers are super excited too, where they're sending lots of love and sending lots of positive messages. So thank you guys very much for coming on board. How are you guys doing today?
We're doing great.
Great, absolutely great. We're really excited to be here with you guys today.
Oh, so are we. And there's lots of love coming in. So before we begin, please let the viewers know a little bit about yourself, on a little bit about your medical background experience.
Sure, I guess I can start there. Hello everyone, my name is Dr. Sophia Reid. I am a board certified dermatologist practicing in New Jersey. I originally am from the Washington, D.C. area. I did my medical training at Georgetown University. Over there, I then went over to California, across the country, to do my medical internship training with University of California, Irvine. And then I completed my dermatology residency at Albert Einstein Montefiore Medical Center in New York. So I'm very excited about hyperhidrosis. It's a topic that comes up very frequently in my practice. And so we're really happy to be kind of sharing a lot of information and doing a really good Q&A session with you guys. And really a big thanks to Dermadry for giving us this platform to be able to talk to you guys about hyperhidrosis.
Thank you very much for sharing that.
Hi, everybody. I'm Dr. Jason Chouake. I'm also from New Jersey. I did my medical school up at Albert Einstein, and that's where I met Dr. Reid, where we trained at Montefiore Medical Center and dermatology together. I'm also super psyched to be here and to talk to you guys about Dermadry, which is a product that we just love.
Oh, we're super excited to hear. And we had many questions that were coming in concerning, about hyperhidrosis, about iontophoresis treatment. A lot of questions came in on, does hyperhidrosis affect me when it comes to iontophoresis treatments? Is that something that would work for me? How does it work? So we collected some questions. We have about 4 questions to kind of walk through. So the viewers out there, these questions will help you break down and understand iontophoresis treatment with your questions, of course. So they're going to be doing a live demo for you guys. So with the first question, they want to know, what is iontophoresis? So can you kind of give us a little bit of a breakdown while also doing the demo with the patient?
Sure. You want to go first?
I think that, first I just want to say thank you to our patient here for volunteering to also be on camera with us.
Sorry to cut you off. Is it possible just to speak a little bit louder? We hear Dr. Jason, but for you, I think maybe it might be cutting off with the mic.
Okay, all right, I'll definitely speak up a little bit more. And I think once we're done with the patient demo, we can take the masks off and then it'll be a lot easier to hear us as well. But just with COVID and everything else, we want to make sure that we're keeping our patients safe. So, but I do want to say a thank you to our patient for volunteering to allow us to film this session with her. And she graciously agreed to come on the live and kind of talk about her experience with hyperhidrosis and sort of her experience with using the device. So we have her set up currently. Everything is ready to go with the device, and she's actually about 8 minutes already into her treatment, and she can kind of tell you how things are going. We'll give her a second. But to kind of start, iontophoresis is basically a process where we use this really light electric current through the hands to really disrupt the sweat glands and stop them from producing sweat. And it can be used in multiple areas. Very commonly, we use it on the hands, the feet, and also can be used in the underarm area or the axilla to help also prevent sweating in those areas as well. So very comfortable treatment. It's a very safe treatment. It has a really, really light electric current. Amanda can kind of tell you what she's feeling and what she's experiencing with that. But it's a very safe, effective treatment with a little mild electric current that really just disrupts those sweat glands to kind of halt that sweating for a period of time.
Thank you very much. And thank you again, Amanda, for coming on board today with us. just to do the treatment. And thank you very much, Dr. Sophia, to kind of break that down. We also want to know a little bit, is it safe? A lot of questions were coming in and asking, is iontophoresis safe for them?
So iontophoresis it's actually a very, very old technology. It's not a new technology. It's been around, I think it was first described in the 1700s, actually, the earliest descriptions of iontophoresis. So it's been around for a very, very long time. It's totally safe to use. It doesn't affect the body. It can be used in people of any age, and it's not painful. And, compared to other treatments that we have for sweating on the hands and feet, it really is the gold standard of treatment for any sweat issues on the hands and feet.
Mm-hmm. And I know she's beginning now the treatment, but how is she feeling right now? Do you feel any type of tingling sensation while using the treatment?
Yeah.
Amanda, can you tell us about what it feels like?
It's just a little tingly. It's nothing uncomfortable. And it kind of increases as the time goes on, the tingling.
Is it painful?
Not at all.
Thank you very much for sharing that. Yeah, there was a lot of questions that were coming in. Some people were worried about if it was painful for them. And, I'm really happy to hear that she doesn't feel any pain at all. Also, going into...
It's not supposed to be painful at all. There's different settings for the machine, but especially when you're starting out, you really want to use the lowest settings. It is not supposed to be a painful treatment. And over time, as your hands get used to it, you'll find that you will be able to increase the power of the machine. But especially when you're first starting out, this is not supposed to be a painful treatment. You're supposed to feel a little bit of tingling. If you're feeling pain, then you're on too high of a setting. You really should be decreasing the settings on the machine, which is very easy to do.
And for those who haven't seen the machine before, or those who are not familiar with what an iontophoresis machine looks like, it's really, really simple. It took us less than, 3 minutes to put everything together and get started. So it's super simple to do, and it's really convenient. You can sit at home and watch TV while you're having your treatments. The treatment times are typically about 20-minute sessions that you're going to do per body area. So if you're somebody who has a hand sweating and foot sweating, you would do 20 minutes on the hands. Then you can alternate and do 20 minutes on the feet as well. Super easy. It comes with the 2 trays here, which actually kind of close in together as like almost a little suitcase to keep all of your materials together. Are you guys able to see it in the shot there? Are you getting a good visual for it?
Yeah, maybe tilt the camera just a little lower. Amazing.
Okay, good.
This is the treatment setup right here.
Yeah.
2 trays, 2 towels, 2 plates, and then 1 controller device right over here.
Right. And so I don't know if everybody can kind of see where the controller device is. It's plugged into the wall, so very easy. And you just pick your treatment area, super simple. You press the button depending on which area you want to treat, if it's your underarms, your hands, or your feet. And then you just press the power button and hold it for a couple of seconds, and then the treatment starts up on its own. Very, very easy to use. And then you have kind of the dials that can control the intensity as you're able to kind of tolerate it for subsequent treatments. The cables, very easy. You just connect them. They're called banana cables. You just connect them to the electric trays into the actual power hub, and then you are good to go for your treatments.
Amazing. We're super excited. And I know, viewers, I see you guys asking multiple questions. We'll get to them shortly, I promise. Thank you very much for giving that quick briefing. We do have one more question when it considers that. We did kind of ask a little bit if iontophoresis is for me. I see now there was another question that kind of popped up asking it, how can they evaluate if iontophoresis treatment will work for them?
Should I take this one?
Go for it.
Sure. So the truth is, Iontophoresis works for almost everybody. There's very, very few people. I think it's a greater than 90% efficacy in terms of improving sweating on the hands and feet. And for a lot of people, you're going to start out doing a treatment like a couple of times a week. And then most people over time, as the machine works over like the course of about a month or several weeks, you're going to notice that you're not going to need treatments as often. And you're going to start spacing out your treatments to once a week, once every 2 weeks. Mm-hmm. And then sometimes people even only need a treatment like once a month or every couple of months. And that's one of the great things about Iontophoresis. It's not painful. And then as it starts to work, the hands sweat less. And so if sweating on the hands and feet is a problem for you, if it impacts your ability to work, if you're in work boots and your feet are your sweaty feet are causing major problems there, if you're an athlete and sweat is impacting your ability to perform, then this is really such a wonderful, easy treatment without any side effects. There's no needles. It's not like Botox, which is very, very painful, especially on the hands and feet. It's a fantastic treatment. And one of the other things that I really like about Dermadry is I think it's probably one of the smallest packages for Iontophoresis. It's not a big bulky machine. It's small. It fits into one little folio. You can keep it pretty much anywhere, and you can take it out when you need it.
Not to mention the convenience of being able to do this in your own home. You don't have to come into the office for your treatments. With some of the other treatment options that we have for hyperhidrosis require you to have to come into the office frequently to have it done. This is something you can do in the convenience of your own home, while you're kicking your feet up and watching TV. So, I love that convenience for my patients, and so and they really love that too as well. So you really have really good control over your treatment, and you can kind of take control over how much you want to sweat, how little you want to sweat, and then you can make those adjustments and really dedicate to the treatment. And Dermadry just makes it super easy to be able to do that because everything is just so intuitive in how to use their particular product. So
thank you very much. And
on the end of her treatment. Amanda's coming up on the end of her treatment. So we can go ahead and turn this off now, unless we had more questions that we wanted to kind of answer while we still have her present for the demo part.
Yeah, no, not a problem. Thank you very much, Amanda. I hope the treatments went well for you, and we're really excited to look forward to hearing more of your results. We're going to give a few minutes for them just to set up, make the patient leave the room, and they'll come back to us in a few minutes just to answer some of your questions. Guys, thank you so much. We see the questions coming in. Thank you very much for giving all the love and support. We see all the little hearts that are coming in. And thank you very much. We got many questions, and we know we are very excited to speak with Dr. Jason and Dr. Sophia. We know it might be difficult with the mask. However, in this period of time now, we're going to be able to go ahead, answer the questions, and they won't be wearing the mask. So please don't worry for those viewers that weren't able to hear, not a problem. So welcome back, guys. Thank you again for the demonstration. I think they really appreciated the viewers. They gave them a kind of an insight a little bit on how it works and if it works for them. So if anyone does have questions and they are in the New Jersey area, you could always reach out to Dr. Sophia or Dr. Jason if you have any questions. Going in now for the Q&A part of this interview, there was a question that came in when it came to hyperhidrosis. They want to know, it is considered a silent handicap, quote unquote, and they want to know how is it, or how can you deal with this debilitating condition? Can you kind of give us a little explanation on that?
So I think hyperhidrosis is one of those conditions that so many people have. Statistically, the studies have shown about 5% of the population is affected by hyperhidrosis. That's a pretty significant number of people who have this issue. And, even taking it one step back a little bit, hyperhidrosis in general is just defined as excessive sweating beyond what is normally needed to be able to keep your body temperature normal. So some people are like, I'm not not sure that I have hyperhidrosis, but I do sweat a lot. So, we want to make sure that we're defining it so you can understand if this is something that maybe you should be seeing your board certified dermatologist about. And so when we think about hyperhidrosis, it's a condition where there's nothing that stimulates you to sweat. So most people normally will sweat if they're working out, if it's hot outside, sometimes even if they just get a little nervous, it can be a normal sweat response. When we're talking about hyperhidrosis, we're talking about people who nothing out of the normal is happening. They're not exercising, they're not hot, they're not overworked, they're not stressed, but they start sweating. And common areas that are affected are the underarms, hands, and feet. Although there are other areas such as your face, chest, other body areas that can also have production of excessive sweat when you have hyperhidrosis. And so, that's kind of the basic definition of it. And so a lot of our viewers might be wondering, like, do I even have hyperhidrosis? Is this something I go to my doctor about? If any of those things that we just talked about kind of resonate with you and you're like, oh gosh, I was just watching TV and all of a sudden I'm grabbing the remote and it's sweat, and there's sweat there, then definitely you should be somebody that's coming into your board certified dermatologist's office and having that open conversation, understanding that this is a lot more common than people think that it is. And so it's not something to be ashamed about. It's not something to be embarrassed about. It is a medical condition that we definitely have options of being able to treat. So just keep that in mind as well. And really it's something that you should be talking to your dermatologist about.
Thank you very much for the breakdown. And it is very important to share with the information with your dermatologist. And, it has been this taboo topic and this kind of topic that, sometimes they're even shy to speak with their family members or even with their dermatologist. Going into that, what kind of stories have you guys encountered or that you can share with us that could link with this taboo topic? How are people slowly breaking free with hyperhidrosis? How are they breaking free from the taboo topic and making it and normalizing it?
I think for a lot of people, sweat can just be so embarrassing. I've had patients come in and say, like, I don't really know if you're the right person I should talk to about this, or, this is like a really embarrassing problem that I have. But you really should feel very comfortable with your physician talking to them about, any problem that you have. And a lot of people might say, oh, it's just sweat. It's nothing. It's not a real problem. But it can really impact your life, and it can affect how you feel socially. It can make people feel very self-conscious. Sweat can really impact your life in so many ways, just socially, aside from the fact that, if you're walking, in the days when we used to shake people's hands, people might feel uncomfortable shaking somebody's hand, or if you're working like on a construction site and your boots are getting filled with sweat all the time, or if you're an athlete or you're playing tennis and you can't hold a tennis racket, or you're rock climbing and you can't get a grip. I mean, there are so many ways that sweat can affect your life, aside from just socially. And I think it's one of the reasons that we were so excited to, partner up with you guys is that people have to know that there are options out there to treat hyperhidrosis, especially things that can affect, the hyperhidrosis long term, that don't require needles, that aren't painful, and that aren't irritating.
And I think kind of just bouncing off of Dr. Jason, I think you might even agree with this too. I think there's an educational component to it as well. And I find, just from personal experience with my patients, it's a lot of a younger patient population that's coming in really concerned about this. And then there's an educational.
We're just waiting now. We kind of just logged out. It won't be too long. Okay.
Yes. Technology.
So, yes, I think maybe there was some Wi-Fi connection that kind of didn't, but not a problem. It's okay that it froze on your end. Don't worry about it. Can you just rephrase on the aspect of the jumping on what Dr. Jason said?
Yeah, so I'm not sure exactly what the last thing everybody heard was, but I was basically kind of talking about my experience with patients, and so the educational component that comes with that. A lot of my younger patients have a hard time explaining to their parents that this is not a cosmetic issue, that it actually affects how they feel about themselves, the things they're able to wear, the activities they're able to do. And, I've had patients in a significant distress in my office, trying to get their parents or their significant other to understand what they are experiencing from just having excessive sweating. And so I think there's definitely an educational component that we do. I'm sure Dr. Jason does a ton as well in the office of just kind of educating the people around that patient as well, that this is something that's a medical condition and they shouldn't feel bad about it. And it's okay for them to actually go to the doctor and get help. And it's something that is treatable and they shouldn't feel ashamed. And we want them wearing their whatever color, shirts and outfits that they want to wear. We want them to be able to wear it. And so, there's an aspect of that as well. So just kind of touching back on kind of your question about what are the kind of stories that we've had with our patients and the patient experience.
Yeah, and actually linking to that, there was a question that came in asking about, can in your teenage years, can that also trigger hyperhidrosis?
Yes, it definitely can. Some people, you can get hyperhidrosis at any point during your life, but for most people, it is triggered around puberty. Some people do have it before puberty as well, but for a lot of our patients, it can be triggered around, the hormonal surge and during puberty.
And there was also another question that came in. I know you kind of touched upon a little bit, but can it be genetic having hyperhidrosis?
Yeah, so there studies have shown that there is a genetic component. That's not the explanation for everybody, but there is a certain percentage of people that do have a genetic predisposition to having hyperhidrosis. It's like, oh, my mom had this issue, my dad had this issue, two of my aunts have this issue, my brother had this issue, which is why sometimes they feel like it's not a real issue for them to talk about or to come to the doctor for, because everybody in their family has had it. And so, again, there's definitely a genetic component that can be seen with it. So, definitely something to consider.
And now there was some questions that are going into the actual iontophoresis treatment, such as Dermadry. They want to know, the first one is, you kind of touched upon it a little bit at the beginning, but we'll maybe kind of do like a recap for the viewers that might have logged in now. How does it actually work when it comes to iontophoresis treatment?
So yeah, when I first heard about iontophoresis, I was like, oh, that's nonsense. That doesn't make sense. But iontophoresis is really, if you look at the National Hyperhidrosis Societies and the International Hyperhidrosis Society's recommendations, it is the #1 recommended treatment for sweating on the hands and feet. And you can look in every single internet forum, whether it's Facebook, Reddit, if you have sweating on the hands and feet, they're talking about iontophoresis because it works. And it's kind of a tough pill to swallow because for most people, it's not covered by insurance. Previously, some of the other devices were prohibitively expensive. But one of the great things about Dermadry is that it is really affordable, especially when you compare it to other iontophoresis devices, the fact that once you have a machine, you have it for life, and you're not going to be spending money every month on antiperspirants. You're going to have your device, you buy it, and it's yours. And so it's one of the few treatments that works. It's very cost effective, especially when you compare it to other treatments for hyperhidrosis. The proof is in the pudding. People, once they have their machines, they really don't need any other treatment, especially if they're only having sweating on the hands and feet.
And thank you very much for that input. And there's another question that came in. They want to know, when someone has hyperhidrosis, is there a link between odor and hyperhidrosis?
So there's a yes and no answer to that. We all have natural bacteria that sits on our skin. And so what happens is once we start sweating, it really kind of makes that bacteria that's sitting there become a lot more active and more pungent. That's why we get that discoloration in the underarms. That's why our sweat starts to have a odor or fragrance to it. It really comes from kind of the bacterial composition of the skin kind of in combination with the sweat. So sweating itself doesn't have to be a smelly thing, but it for a lot of people it is because of the bacteria that's on the skin. So in those kind of situations, sometimes we do recommend things like antibacterial soaps that you can get over the counter to kind of wash the areas, just to kind of help with the odor side of things. But your deodorants that you can get also over the counter are very helpful at being able to mask those smells and neutralize them. But if you're looking at doing a treatment or doing the treatment and then not having to wear anything after that, then using things like antibacterial soap can also be very beneficial. So kind of reducing the smell that does come with it.
Yeah. Those are great tips and tricks. And to also add on to that, when it comes to using Irontopheresis treatment, also depends on the individual. However, most of the time, the odor is kind of odorless when they use Irontopheresis. So a lot of them kind of just use deodorant just to kind of get that smell because they're so used to exactly that, like day to day, they want to have that strawberry smell or that fresh, clean lavender. But usually for the viewers out there, that if you are using Irontopheresis treatment, you don't have to really necessarily worry about an extra odor. Yeah. Now there is another question that came in. Some people, we did mention that hyperhidrosis, does affect you for your lifetime, but they want to know, is it permanent when it comes to hyperhidrosis? Even though we kind of mentioned that it is permanent in a sense for lifetime, but they kind of just want to re-ask the question.
So for most people, if you're an adult with hyperhidrosis, you're probably going to have hyperhidrosis for the vast majority of your life. But there's, for most people, it does not go away. Once you have hyperhidrosis, you sort of have it for a long time. How would you agree with that?
I would agree with that. There's options such as Dermadry make it very manageable to be able to have it. And it really reduces the frequency of treatments really reduces as time goes on. And so that's kind of the great part about it is that if you are somebody who is a lifelong sufferer for hyperhidrosis, doing a treatment once every 2 weeks or once a month for 20 minutes while you're sitting at home, is very easy and convenient. And so it doesn't have to be something that really interrupts your normal flow of the day or your normal sort of routine, or, you don't have to carve out any significant portions of time in the day to be able to actually do your Dermadry treatment. So, it makes this kind of chronic disease that people have, hyperhidrosis, a lot more manageable on a day-to-day basis, because the reality is that for most people, it's not going away permanently.
Yeah. And, that's something that we're kind of, we want to have that advocacy and explain that there are treatments out there. And there are also a lot of support groups for them to kind of share their information. Also, internal, if they don't want other people to know about it, they could kind of just share their it's a safe space, basically. So, we want to continue and share that as well. There is also another question that came in. So for the viewers out there, would you, they want to know, do they need to worry about any compensatory type of sweating using Iontophoresis?
With Iontophoresis, especially because the area that you're using it is so small. Usually, I would say most people do not get compensatory sweating in other locations of the body. It's not a common side effect of Iontophoresis at all.
So in theory, with any reduction in sweating, in theory, it's always possible to get that compensatory sweating in other areas. But kind of like how Dr. Jason mentioned, I haven't seen that much with Iontophoresis. I've definitely seen that with other treatment options that are out there. And then we get a lot of, complaints from patients that are like, well, I'm not sweating under my arms anymore, but now I have this like butt sweat, you know, and now they've created it. They have a new problem now that was created. I don't get that feedback from my patients when they're using iontophoresis. So in theory, it's always a possibility that you can get some compensatory sweating, but it just doesn't seem to be very common with this particular method of treatment for hyperhidrosis.
Yeah, when I speak with clients or patients, I get the same feedback, you know, depending on what they use, but for iontophoresis in general, they haven't had any type of compensatory sweating on that end. There was another question that came in. They want to know, is iontophoresis safe for people that do suffer from eczema?
I like this question.
This is a really good question. You know, sweat can be a major trigger for eczema on the hands. And so I find that, you know, for patients that have hyperhidrosis and eczema, it's really the sweating itself that's a major trigger for their eczema. And so overall, especially when you're only using iontophoresis like a couple of times a week, I believe that it helps eczema. Especially if you have those two problems together. What do you think, Dr. Reid?
I totally agree with you. I think reducing that sweating really helps to kind of reduce some of the trigger for the eczema. I think there's a component also, though, you know, when we think about eczema, we also think about like frequent hand washing and dehydrating the hands. And so, you know, your hands are sitting in a water bath essentially for about 20 minutes. And so, you know, patients who are more prone to eczema do need to have good kind of skincare practices after they finish their treatment. So really hydrating well. So that way their hands don't feel dry after the treatment, so that it doesn't trigger another component of their eczema. But overall, I think there's definitely a benefit in reducing the sweating for patients who have eczema, and then really practicing really good hand care, hand skin care after their treatment in order to make sure that they don't have any further complications with their eczema. So they have a little bit of an extra step, but it's really important and really helpful for them still to control the sweating.
Thank you very much for that insight. And I think you were getting lots of love and hearts. I think a lot of people were kind of, you know, understanding that, and kind of thank you very much for that insight. For the people, for those who do suffer from eczema and have hyperhidrosis, you know, they fall into another type of pool, and they're sending you lots of love.
You guys can do it too. If you have eczema, don't think this isn't for you. You can definitely benefit from this, and, you know, definitely talking with your board certified dermatologist about how best to take care of your hands or even your feet, the treatment area after, you know, in relation to your eczema is really important, but it's 100% helpful for you. So, you know, you should definitely look into it as an option. You guys, there's options out there for you. So don't think you can't do it.
Yeah. And there's also another question, actually. Instead of now moving forward from the eczema, they want to know, can iontophoresis darken the armpits?
I don't think it's ever been associated with armpit darkening. It's a very gentle treatment. Usually when people have dark skin under the armpits, it's related to how thick the skin is in that area. And it's not, doing iontophoresis does not make your skin thicker. And it's really a very gentle treatment. It's not irritating. And so it should not darken the skin under your armpits more than it already is.
Listen, you're more likely to get dark armpits from all the shaving that you're doing and the waxing that you're doing and the plucking that you're doing than you are with the iontophoresis. That's just the reality of it. I mean, other things will lead to darkening of the armpits, but this not so much.
Yeah, I couldn't agree more with that. And going to the next question, now this is more on technical terms. They want to know, technically speaking, why does it need to be with tap water for the treatment to work?
For the treatment, so we're using a little bit of electric current, and you're putting your hands in a little bit of electric current. That water has to have some kind of ion in it for the current to be able to flow through your hands. If you use distilled water, there's no salt ions at all in that water. It can't conduct electricity. So that's why you have to use tap water.
Thank you very much. Did you have another thing to add?
No, that pretty much explains that. I'd just be saying the same thing.
There don't have to be ions in the water for iontophoresis work. I mean, the first three letters of iontophoresis is ion, and so there have to be ions in the water for iontophoresis to work. That's why you have to use tap water, not distilled water.
Thank you very much for that. And depending also where you are, for example, we had, I was speaking with someone that was, on the other side of North America, and, they were saying their tap water was kind of soft, it wasn't working. So we actually recommend maybe sometimes always using like a small pinch of table salt that may work. When it comes to now, when it comes to recommending, or increasing actually the treatment, they want to know when it comes to increasing the voltage, how do you recommend when they should increase the voltage?
So, you have to do what's comfortable. It's not supposed to be painful. So you should increase the voltage up to where you can still feel it. It should still be tingling, but it shouldn't be painful. And, you can always, if you're at too high of a voltage, you can always decrease the voltage to where it's comfortable. And so I would say you want to go as strong as you can without it being painful or uncomfortable. You shouldn't be like jolting out of the machine. It should be, you should feel it. It kind of feels a little bit like pins and needles. If your hand falls asleep or your foot falls asleep, but it shouldn't be painful. If it's painful, you're at too high of a voltage.
Right. And for someone that has mild hyperhidrosis, what would you recommend in that sense for them to start when it comes to the voltage?
So when we're talking about, mild, moderate, and severe, the voltage, again, it's kind of really what you can tolerate. I more would say we adjust the treatment frequency more so than even the voltage, because each session you should really kind of be going with what is comfortable but not painful, kind of like how Dr. Jason really emphasized. And so if you're somebody who has more mild hyperhidrosis, you may only need to do the treatment 3 times a week instead of 5 days a week. And then you might find that you get a benefit of reduced sweating within a 1 to 2 week time frame. And then you can kind of move to your maintenance treatments of once every 2 weeks or once a month going forward after that. If you're somebody who has more moderate or severe sweating, you might need that everyday session for 5 days a week, sometimes even 7 days a week. We do recommend you have a little break at least 1 day in the week, but you might do a 5 or 6 day session for 2 or 3 weeks straight before you kind of notice that you've gotten that benefit, and then you kind of reduce it down to your maintenance treatment. I wouldn't necessarily change the voltage so much per treatment as I would just change the treatment frequency, depending on whether you're mild, moderate, or severe for your sweating.
And before we go into a little bit more detail about the maintenance, thank you very much for talking about that. We just wanted to specify a small detail because we saw a question come in. When it comes to adding the pinch of salt, we really recommend using mineral water instead. We do not recommend really that pinch of salt. It's really mainly you would have to either speak to one of our customer support team if you have any issues at Dermadry, or also to your dermatologist. Linking back now with maintenance, we know that you've touched upon the maintenance schedule of 3 to 5 times. However, can you kind of give a small example a little bit on a patient that you had, for example, on what type of maintenance schedule that they had?
So basically, it's really very person to person dependent. So in the beginning, you're going to want to use it 3 to 5 times a week until you start to see improvement, and then you slowly decrease the sessions as needed. So after like 2 or 3 weeks, you might find you only need it once or twice a week, and then you might only need it once a week. After about a month, you might only need it once every 2 weeks. And you're going to be the first person to know when your hyperhidrosis is starting to act up and come back, and that's when you're going to want to increase the frequency of treatments. So there isn't one specific protocol. It's very person-to-person dependent. So we're going to want you to use it more often when your hydrosis is active, and you're going to use it less often as you see that your hyperhidrosis is improved.
Thank you very much for letting the treatments, giving the treatment schedules. I think that actually helps the viewers a lot. Also, depending on, your severity, you could always speak to your dermatologist and also see what would fit best. There was another question that came in. They want to know, how should they be happier? How can you help them to be, happier and live with hyperhidrosis? And before you do actually answer that question, I just want to know if it would be possible just to speak a little bit louder. I think there was a comment that came in that they weren't able to hear. So just to repeat the question, how to be happy with hyperhidrosis when it comes to their self-esteem and their day-to-day life.
Treat it. Treat your hyperhidrosis. It's not something that you have to accept as a condition that you have, but it's not something that you actually have to deal with all the time. I mean, there are ways of being able to kind of limit that sweating enough that it doesn't change what you do on a day-to-day basis. And so if it bothers you, there are ways to be able to really minimize how much it changes your everyday routines. So, for those people that are out there kind of suffering with it and trying to figure out, like, how can I live a normal life? There are options. Dermadry is a wonderful option. Definitely talking to your dermatologist about whether Dermadry is right for you is step number one in being able to really kind of.
You can yourself. Okay. Yeah, about whether or not you can process your hyperhidrosis.
Right. Is the sound a little bit better? Are you guys still able to hear me?
Yeah, we still hear you.
Okay, perfect. Yeah. So, you really don't have to accept being sweaty. That's kind of the bottom line of it, is that you are able to really be able to treat your hyperhidrosis and get it to a point where you're comfortable and it's not changing your everyday life and your everyday routine. And you can wear the white and you can wear the gray and you can wear your yellows and all those kind of things that you really want to, and not have to base your outfit based on your sweating. So I think there's a level of acceptance of saying, like, yes, this is something that I have. That's step number one. And then step number two is, okay, let's figure out how we can make this better, so that I can live a really normal life.
Mm-hmm. Thank you very much. And there was another question that came in linking with Iontophoresis treatment. They want to know, what if their hands are too dry? Should they have some type of moisture? What should they do?
So if your hands are really, really dry, then after the Iontophoresis treatment, I would recommend a really thick balm or ointment immediately after the treatment. So the second the treatment is over, your hands are probably going to be a little bit wrinkly because they've been sitting in water for a little while. That is the perfect time to moisturize. So immediately after the treatment, you're going to want to put on like Vaseline, Aquaphor, CeraVe healing ointment. I love Aveeno eczema balm. But you're going to want to use something that's a little bit on the thicker side, so something that's a cream, balm, or ointment instead of a lotion. So if your hands are really, really dry, you're going to need something thicker than a lotion.
Okay, perfect. Thank you very much for those tips.
Put those on before the treatment. So that's another key point, because you'll kind of interfere with how well the current is able to actually conduct. So we don't want to put any of those oil, ointments, or balms on prior to the treatment. We want to make sure that we're saving that moisturizing tip for after we finish our treatment.
Yeah, that's a great point.
That's a very good point. And for example, if someone does have some type of hand cream, for example, what should they do before using the treatment?
So I would just make sure that the hands are really clean before using the treatment. And I would save that hand cream for immediately after the treatment.
Okay, perfect. And there was another question that came in. There are different types of hyperhidrosis. We have primary and secondary. They want to know, what are the differences and what are the proportion of it?
Can you elaborate a little bit on that question?
So when it comes to the proportion, like, what are the percentages of who is really using, who really has primary hyperhidrosis and secondary hyperhidrosis, and also when it comes to the time using the treatments?
So the treatment is going to work regardless of whether you have primary or secondary hyperhidrosis, because Iontophoresis is working directly on the sweat glands that are inside of the machine. So it doesn't matter really why you're getting hyperhidrosis. The electric current is going to deactivate your sweat glands. And so, the exact like reason why you're having hyperhidrosis is sort of less important than whether or not the technology is going to work for you. And it works for all types of hyperhidrosis. As long, but the real issue with iontophoresis is that it will only work for, specific areas. We can't use it everywhere. If you're having sweating in the groin or genital area, unfortunately, you can't really use iontophoresis for those areas. You can really only use it for underarms, hands, and feet, because those are the only parts of the body that kind of fit into the machine. That's really the biggest limitation.
Thank you very much. And to link back, so iontophoresis does necessarily treat both when it comes to secondary and primary hyperhidrosis, right?
Yeah.
Yes, that's correct.
Yeah, that's correct. It'll treat both of them. I think just piggybacking off of what Dr. Jason was saying, when we think about secondary hyperhidrosis, we think about there being like an additional cause to why you have your hyperhidrosis. And so for some people, it could be different medications that they're on that are making them sweat a little bit more. It could be that they are more obese, or they have more endocrine or hormonal issues that could be contributing to why they sweat a little bit more. And so there's another kind of modifiable factor there that they can kind of take control of in some cases, that they're able to kind of, if they're able to either lose weight or kind of modify their hormones, get their hormones under control, change whatever medication might be causing them to have some sweating, it can be helpful from that standpoint, because they have a little extra step of things that they can do to improve their sweating. But ultimately, let's say you're on a medication that you just can't change, you need it, there's no way around it, then iontophoresis is going to work for you either way. So it just, I don't know if that's what the question was coming in from the audience, if that's kind of what they were getting at. But yeah, like with secondary, there are some other things that you can kind of modify with it, but Dermadry will work just as well if there are aspects that you can't change, even if you have secondary.
Thank you very much for that input, Dr. Sophia. That was there was a few questions that were kind of linking to that. So I think they just wanted that small clarification between both. Just to let everyone know, for the viewers out there, we do have 4 to 5 minutes left. So we're going to kind of wrap up with the last few questions that we have. There is one question that came in now concerning about feedback. What feedback do you guys have or get from patients when using iontophoresis?
Besides the fact that they love it, I mean, because they absolutely love it. It's easy. It's just so easy to use. I mean, we have patients that come in for various different types of treatments for their hyperhidrosis. And literally the ones that are doing the iontophoresis are so happy. They don't have to come into the office all the time. They don't have to deal with like numbing cream and painful needles. They don't have to deal with like burning when they're putting on topical things, at nighttime before they use it. They're actually some of the happiest people there. They just watch TV, do their treatments, turn on some music, and then they're good to go. And then the fact that they can actually, only have to do a treatment every couple of weeks once they're kind of in that zone, it's great. They love it.
Yeah, and one of the most surprising things that I found with iontophoresis is that patients don't need to use their machines as often as they think they're going to after a while. And so, it's you really can get persistent long-term results for a lot of patients that find that they really, after a while of using the machines, they only need it once a month, once every 2 months. And so, they don't need to use it as often as they thought.
Thank you very much for that insight. And I think it gives them kind of that overall view. And I'm really happy to hear that feedback. And, summer is around the corner. We want to know if, what are tips and tricks that you can give the viewers out there to help treat their hyperhidrosis, especially during the warmer months?
There was one, I'm going to get to your question in a second. There was one comment that I also wanted to make, and I think Dr. Jason touched on it a little bit earlier, but I think it's really important for your listeners to know as well, is that, there is ways to be able to get this covered with your insurance too. So I don't want patients to look at this and be like, oh, it's cost prohibitive, or I can't afford it, or, how am I going to pay for this? If it is something that your doctor feels like is going to be beneficial for you, there are ways that we can always appeal to the insurance company. It always depends on your coverage, but that we can appeal to the insurance company to try our best to be able to get it covered for you as a medically necessary device for you. And so I know Dr. Jason kind of touched on it earlier, but I really wanted to just kind of drive that point home so nobody feels like, that they can't afford it, and that's why they wouldn't be able to go for this treatment, because there are ways that through your insurance we can try to get it try our best to be able to get it for you if we really think that this is going to be beneficial for you. And then, sorry, ask your question one more time and then I'll answer it. I just wanted to
No,
be
not a problem, not a problem. But thank you very much for that. And that's a very important point to bring up when it comes to the insurances. You know, if anyone has any questions or having any issues, you could always reach out to our customer support team, and we could send over some links that could help you and your medical professionals. As Dr. Sophia and Dr. Jason both know, they are both aware of the letters that we have to support that for your medical necessity insurances. And yes, to link back with the question now, you know, we are going in the summer months, the warmer months. We want to know what are tips and tricks that you could help give to the hyperhidrosis sufferers out there.
So the most important thing is to step up your treatments as we're going into summer. You know, if you know, have been approved by your insurance for Botox under the arms, maybe it's time to come in. And if you have an Iontophoresis machine, it's probably time to just step up your treatments a little bit in anticipation of the fact that it is going to be warmer, you are going to be sweating more, and you might find, especially even if you have an Iontophoresis device and you're controlled through winter, and you haven't used it so much during the winter, that as the weather warms up and you start to sweat a little bit more, you may find that you need treatments a little bit more often. But yeah, summertime is tough for hyperhidrosis. It's not an easy time. And I think it's also important to remember that everybody sweats, whether you have hyperhidrosis or not. And so when the weather's warm, like you might be sweating a little bit more if you have hyperhidrosis, but everybody's sweating, and sweating is also normal. Yeah. You just sweat a little bit more than maybe your neighbor, and you know that's okay too. And so if you have a day where it's really hot outside and you're sweating, you know, just don't worry about it because everybody sweats.
And thank you very much for touching upon that point and sharing some tips and tricks. You know, it is getting a little bit difficult during the summer, like the warmer months, but you know, we'll support each other and we'll be all together when it comes to that. And we really appreciate your tips and tricks. Before we go, we do have some few questions. There's a bit 2 or 3 questions that we could kind of wrap up with. The first one is they want to know, the viewers want to know, is there a link between dehydration and hyperhidrosis? Is there a link between these two?
You would have to have a really significant amount of sweating in order to become dehydrated from your hyperhidrosis. I think in my career, I've maybe seen one case where maybe we could link the amount of sweating that they had to the fact that they were becoming dehydrated. Again, it was the summertime, so you know that's something to also consider. There's other factors. It's hot. There's sun. You know, could it be other reasons that they were getting dehydrated? Yes, but it's not very common for you to sweat so much that you can dehydrate yourself. That being said, you know, dehydration comes from water in, water out, right? So if you have more water coming out than you have water going in, then there's always the possibility. And some people are more sensitive to that than other people. So if you feel like you sweat so much and then start getting lightheaded and, you know, you start feeling really, like your lips start feeling dry, or your mouth starts feeling dry, then that's really a sign from your body that you need to make sure you're hydrating yourself well. And so while everybody, and I always say this, everybody's not a textbook, right? So although the textbook says that that's not really supposed to be something that happens, you know your body best. And if you're out sweating a whole lot in the middle of the hot summer and you haven't hydrated, then yes, there's definitely a possibility that you can run into some dehydration issues, and you got to make sure that you're hydrating yourself properly.
And thank you very much for sharing that. I think a lot of the viewers are sending lots of love and hearts. I think they kind of understand that as well. And that was many questions that were coming in. There is another question more on another technical term. When it comes to pregnancy and iontophoresis, it is not recommended to use. It is a type of contradiction that we have, contradiction when it comes to our, you know, our do's and don'ts for using iontophoresis. Have you ever encountered anyone that was pregnant that wanted to use iontophoresis treatment? And can you explain a little bit more about that?
When you're pregnant, we try not to do anything that's extra at all. So anything that, you know, is not significantly affecting your life or your health, we try to limit the treatment of that during pregnancy.
And unfortunately, hyperhidrosis sort of falls into that category. Our treatments are very, very limited during pregnancy. You know, it's just an unfortunate reality.
Once you deliver and you're breastfeeding, you're fine.
Right.
But, you know, during the actual pregnancy part, I mean, it's not necessarily, there's just no studies that say that it's safe. And so that's the biggest thing with pregnancy. There's not a lot of pregnant women that are like volunteering to have things tested on them during their pregnancy to know that these things are safe for us to be able to recommend. And so as a doctor, we practice science, we practice evidence-based medicine, and the evidence just isn't there to be able to say that you should be able to use iontophoresis during pregnancy. Doesn't mean that it wouldn't work, doesn't mean that it can't be effective, but there's just not enough research to say that it's safe for you as an expecting mom to be able to do it. And so there's not really a lot of doctors that are going to recommend it without that evidence behind it to say that it's something that we should be doing.
Exactly. And I think that's a really important point also when you are nursing, you can still use iontophoresis treatment. So I think that is still an important point to bring out for the mothers who are nursing out there. Before we do end off, we want to know is there any final thoughts or advices and recommendations that you could give to the viewers out there?
I would,
Dermatologist.
yes. If sweating is a problem for you, make an appointment to see your dermatologist. And the last thing that I would want to end on is just people should know that they're not alone. You know, hyperhidrosis it's a fairly common problem. So there's a lot of people who suffer with hyperhidrosis, and if it's impacting your life, then there's absolutely no reason why you shouldn't seek treatment for it.
And if your doctor doesn't understand or doesn't give you the information that you want or need, then listen, you go to another doctor as well.
Yeah.
You know, I always tell people, like, having your doctor-patient relationship is so important, and you need a doctor that you can kind of connect and have that relationship with. And so if you go to one person and you're not able to get the answers that you need or the treatment that you really want, then find another doctor that you're really able to kind of connect with, that they're able to understand what you're trying to say, that they understand your condition, and that they're willing to listen and help and offer suggestions on what can be beneficial for you. So don't hesitate, get into your doctor. If you don't get the one that really gives you the answers that you want the first time around, because I've had patients that went to maybe their primary care, and the primary care's like, oh, don't worry about it, and it took them years then to get into a dermatologist afterwards. And a lot of times they were coming to us for something completely different, and they just happened to mention that they also sweat, but they were always told, oh, it's nothing to worry about. So if you're getting that answer, then see somebody else who can really give you some good guidance on what you need to do next and what would be good for your particular situation.
Mm-hmm. And I think that's a perfect way to end off. And with all those recommendations and creating that advocacy, creating that safe space to speak, I think these are all really important points. Also with Dermadry, we've created that safe space through, our communities, our Facebook group. So if anyone wants to share any of their stories, please feel free. You could even do it anonymously, not an issue. So thank you again, Dr. Jason and Dr. Sophia, for coming on the live today with us, doing a demonstration and answering all the questions from the viewers. The viewers, thank you so much for coming in and showing all the love and giving us all.
Thanks so much, Amanda, for giving us this platform, and thanks to the viewers.
Yes, thank you for tuning in. Yeah,
really good questions.
Yeah, we got great questions.
Yeah, and you can always, if you're interested, you can always follow us. I'm Dr. Sophia on Instagram.
And I'm at Ask Dr. Jason on TikTok and on Instagram.
Yeah, so if you have questions, you can send us DMs and we can kind of direct you to the right resources that you need. Okay?
And if you're in New Jersey area, you could always go see them.
That's true. Bye, guys.
Bye. Thank you so much.